Welcome everybody to Daria for this week. We're joined today, we've got two speakers who both be presenting on the issue of alcohol use in Aboriginal and Torres Strait Islanders. Firstly, we have Professor Kate Conigrave, who really requires no introduction, but has worked extensively in the field and is of course also a drug and alcohol physician over at the enemy at Royal Prince Alfred Hospital. Just joking, Kate, of course. And she's joined by Teagan Weatherall, who I believe is in the final stages or has just completed your PhD at University of Sydney. Just submitted. Just submitted. Congratulations. That is no small thing. So they're going to be talking to us both today, about alcohol use and Aboriginal and Torres Strait Islanders. So I might hand the floor over to them. Take it away.
Thanks very much, Chris, for the introduction. And thank you for having Kate and I today. Next slide, please, Kate.
Sorry, it's not advancing, but I'll try.
Okay. We'd just like to begin by acknowledging the Aboriginal and Torres Strait Islander people and the lands which we're all on. So for me, that's the Tharal land. I'm down at the New South Wales South Coast, and just acknowledge the all the Aboriginal and Torres Strait Islander people that had an input into this research that we'll be presenting today, and also the participants. Would also like to acknowledge Scott Wilson. So he's the co-director of the Centre of Research Excellence of Indigenous Health and Alcohol, and also Kylie Lee, who's the deputy director, who's really supported and played a huge role in this research. And also acknowledge all the CRE members. So over to Kate, who'll just give a bit of background.
Thanks, Teagan. So I'm sitting on Gadigal land. I'm actually sitting on the Aboriginal, on the grounds of the Aboriginal Medical Service at Redfern. And in my boss, Brad Freeburn, who's a Bundjalung man, I'm sitting in his chair. So it's sort of appropriate. We're just going to try and give you a snapshot a bit of some of the research of that Centre of Research Excellence of Indigenous Health and Alcohol, and we acknowledge NHMRC funding for that work. So we'll give you a bit of background. We'll talk about the prevalence of alcohol dependence in Aboriginal and Torres Strait Islander communities. We'll talk a bit about patterns of drinking and what that means for clinical practice. And if time allows, we'll talk a bit more about the CRE and its members and the work they do. Sometimes advances and sometimes doesn't. Okay, if I click. Oh. Okay, so many of you know that around the time of colonisation, that sudden increase of access to strong alcohol came at the same time as Aboriginal people were undergoing major traumas. Their lands were being taken, their autonomy was being eroded, and their connectedness to culture, to land, to language, all of those really important connections were being disrupted. And of course, back in the day, people were beaten for speaking their own language sometimes, etc. We don't need to go into all the detail, but this was all happening while alcohol was coming in, and people were getting illicit access to alcohol over many years. While there was prohibition that was racially targeted, Aboriginal Torres Strait Islander people couldn't access alcohol. And then around the time of the referendum, not at the same time, but around that time in the late 60s, there was sudden complete access to alcohol for Aboriginal and Torres Strait Islander Australians. Without any preparation, without any phasing in. And it's worth remembering that that's still under 60 years ago. So it's perhaps not surprising that there's been some teething problems. So the research of the CRE, or the Centre of Research Excellence, has been done in partnership with communities and community-controlled services, and with the aim of informing prevention and treatment. And we'll just show you a few snippets of it today. So over to Teagan.
Thanks, Kate. So I'll be presenting some work that was conducted as part of my PhD studies, which was on improving our understanding of alcohol dependence among Indigenous peoples. So as for a bit of background, like Kate mentioned, Aboriginal and Torres Strait Islander people have a lot of strengths, our connections to our culture, traditions, our country, the lands where we're from, and the variety in languages. But like what Kate said, that we've been impacted by colonisation and thus have this, since then, a history of trauma and disadvantage which has impacted Aboriginal and Torres Strait Islander people. And so this history can then put people at increased risk of developing a dependence on alcohol. So we wanted to improve our understanding of alcohol dependence, here in Australia. But first we wanted to look at, well, among Indigenous peoples globally, what is the prevalence of dependence and how was that prevalence measured? For example, like what tools were used? And then looking at a community sample of Indigenous Australians, we wanted to see, well, in this community, what is the prevalence of dependence and what is associated with dependence? For example, any harms associated with dependence or getting help. So how we did this research. So our review looked at these 4 countries, Australia, New Zealand, Canada and the United States, just because they were similarly colonised and have a similar history. And then we wanted to see the prevalence of current alcohol dependence based on ICD-11 features of dependence. And so we looked at community samples that were published in the last 30 years. So what did we find? Well, in our review, we found 11 studies, and those 11 studies were from New Zealand, Canada, and the US, and no studies were found from Australia. We see that the prevalence ranged widely from 3.8 to 33.3%. But then when we looked at studies that had a stratified recruitment strategy, the range was less, it was 3.9 to 16.6%. And then specifically, there were these studies where an Indigenous person conducted the interviews with the participants. And we can see again that range was much lower, 3.8 to 4.2%. And in these prevalence studies, a variety of tools were used, but none of those were Indigenous specific. So in particular of note is that no studies were found from Australia, and yet Aboriginal people and the use of alcohol is very stigmatised in Australia. So if looking at the prevalence of dependence and that stigma, it's like, well, if there's no data there, what is informing that story? And then of note, we found that where an Indigenous person conducted the interviews, that prevalence range was much different. So we're thinking, well, having an Indigenous person or an Indigenous survey tool, how does that, does that impact the research? Because, Aboriginal people have different worldviews, they have their culture, things that's important. So do these sort of things play a factor? And then as mentioned, there are no Indigenous specific survey tools used. So again, how does that affect, how does that inform the data? So next we wanted to look at a community sample of Indigenous Australians. So we conducted this survey using the GROG survey app. So that's an Indigenous survey tool. Well, it's a survey tool that's been specifically developed for Aboriginal and Torres Strait Islander people. And this is just a little snapshot. So, a lot of thoughts has gone into this app to make sure it is, culturally appropriate, suitable for Aboriginal and Torres Strait Islander people. even thought into every question that is asked of people. It's available, you can, in audio, so the questions and the comments can be read aloud. And the app has been found to be validated and accepted. So the app collects different like demographic data, and also if people report that they drink. So if someone says that, you know, for example, here white wine, they drink white wine, the app will then say, well, what sort of container did you drink the white wine out of? So this has had a lot of input, you know, from Aboriginal and Torres Strait Islander community members and clinicians, sort of to see, well, if we want accurate data, you know, Aboriginal and Torres Strait Islander people, they might not necessarily go into a pub and order a glass of wine and it's measured. They might use a non-standard drinking container. So thoughts going into this as well. So we collected data from a representative sample from 2 sites in both urban and remote South Australia. So to participate, you had to be Indigenous, aged over the age of 16 and living in one of the 2 study sites. So the app asks about the features of dependence based on ICD-11, and it asks about consumption and also harms and also getting help. And the analysis was conducted in the software program R. So what did we find here? We found that the prevalence of dependence was 2.2%. So this is similar to the worldwide prevalence, which I think off memory was about 2.6%. And the general Australian prevalence is about 1.4%, so just a little bit lower. And we found in this community sample that individuals who reported that they drank more alcohol more frequently tended to report more frequent symptoms of dependence. So maybe every day or weekly, as opposed to you know, monthly or not that often. And we found this slight trend where in the urban site, men tended to report more frequent symptoms of dependence compared to women. We also found that these associations of dependence, so we found that dependent drinkers, they were 8 times more likely to report a harm than non-dependent drinkers, but also they were 3 times more likely to get help for their drinking. And then we asked everyone who participated in the research, you know, what would you recommend to a family or friend who wanted to get help for their drinking? And the most recommended support options were from an Aboriginal AOD worker or a detox or residential rehabilitation service. So what does all this mean? Well, from our review, we found that, you know, is there a need for these Indigenous specific survey tools to be used when conducting research with Aboriginal and Torres Strait Islander people? Or if they're not available, for clinicians to operationalise the existing tools that are out there, and how questions, you know, might need to rephrase the question to make sure that an Aboriginal and Torres Strait Islander person understands the question but then can answer it so that the clinician can best help that person to, you know, whether they need a brief intervention or support for their drinking, just getting that accurate data to better help the individual. And we also found that the prevalence of dependence was similar to the Australian and international estimates. So we see that there is this need for that accurate data to better inform treatment needs, because, you know, communities would benefit from that specialised treatment services, but then also maybe communities need more support to help, you know, people who might be heavy drinkers or just episodic heavy drinkers and not necessarily be dependent. So that accurate data can inform what areas of communities need support. And then we found that whilst people recommended, you know, support from an Aboriginal AOD worker or these residential rehabilitation services, they're not always in community. So whilst it is good that, you know, they are supported and get funded, they're not always there. So how best then can services or even individuals or clinicians who are available in community, how can they better support Indigenous Australians? Thank you.
Thanks, Teagan. And Chris, if anyone has questions partway through, we're happy to pause halfway, or otherwise we can take questions at the end. So just butt in, Chris, because I can't see them.
No, sorry, I've turned off my camera. What was I going to say? Well, firstly, thank you, Teagan, for presenting that. There's no specific questions at this stage, so happy to crack on if that's okay, Kate.
No problem.
Yeah.
And excuse me sitting in semi-darkness. This actually is the best lighting that's possible in this room.
That's totally fine.
Okay. So going on from Teagan's presentation, Teagan flagged that we shouldn't be only focusing on people who are dependent and need, pharmacotherapies or resi rehab. We also need to be thinking about people who are episodic heavy drinkers. And of course, in the general community too, that's a common finding. What do we know about patterns of drinking, and how does this influence the approaches that are needed within Aboriginal and Torres Strait Islander communities? And I may from here on just use Aboriginal as shorthand, because most of our research was done below the Tropic of Capricorn. Most of the people we interviewed were Aboriginal rather than Torres Strait Islander. So if we look at a meta-analysis of all available data on alcohol consumption among Aboriginal peoples, James Conigrave published one in 2020 in the journal Addiction, and looking at all the sources in available grey literature or refereed literature, there's a relatively low percentage compared to the general population who drink alcohol at all in the past year, so about 60%. And that compares to more like 80% in the general population. So Aboriginal people are less likely to be drinkers. However, the prevalence of drinking more than 4 drinks on one occasion was a bit higher than in the general population at 34%, and compared to about 27% in the general population. But if you drill down and look at all the data available, you can see the huge amount of variety in every study. So there's the summary figure saying that 59% of people drink any alcohol, but every study has widely differing estimates. So, for example, there's one with very low estimates of drinking, and that was probably done in a remote community where there was limited access to alcohol and where there was more a tradition of abstinence. And then there's one up the other extreme with a very high prevalence of drinking. And where there's lines with multiple dots, it means the one study, for example, this Australian Bureau of Statistics studies, gave multiple estimates, different by gender, different by age groups. So who you're talking to, their gender, their age, and where they are all factors on how much they drink. There's no one story. And if you look at those open diamonds down the bottom, you can see that overall men were drinking more than women, and there's the women there. If you look at the numbers who drink more than 4 standard drinks per occasion, there's the 35% as the pooled estimate we talked about. But you can see there's also big methodological issues, that if you're asking, did you drink that once in the last 12 months? Of course, you get a much higher percentage than if you ask, did you drink that once in the last week? And you can see less than 1 in 10, it looks like, are drinking 4 or more drinks at least once in the last week. So we're seeing evidence pointing to this episodic nature of drinking that Teagan mentioned. Tanya Secretsis has pointed out that estimates of drinking quantity among Aboriginal peoples may be out by as much as 700% in the 2008 national survey. And this example, which came from my clinic in the AMS, is based on a real person. And we asked John, how many drinks do you have in a day? He said 3. And this was 3 drinks of wine. And the next question, of course, is what do you drink it out of? And that was the answer. And he had it there with him. And he wasn't trying to lie or hide the fact he was drinking. That was just his standard drinking container. So he was genuinely surprised that this was the equivalent of about 21 standard drinks a day. So hence the need for survey tools that can help people translate their drinking to standard drinks. But of course, all of us who've been out of school for a few years get a bit rusty on the maths, and some people had a very bad experience of schooling and never got comfortable with maths. So we need something that makes it dead easy, whether, and in this case of the Grog app that Teagan mentioned, the app does all the calculation, the person doesn't have to do maths. So not many Australians generally know what a standard drink is, and drinking can vary with what's happening. There also can be factors that are specific to Aboriginal people that are around that can create barriers to reporting on drinking. And because of this stigma that has grown up around drinking among Aboriginal people, people can be ashamed to talk about drinking. And they also can be fearful of consequences. Are they going to be at risk of child removal? Are they going to be at risk of legal consequences? So whether it's a survey or clinical setting, this is important. So this is the app that Teagan mentioned, just to show you a few more shots from it. And Kylie Lee and Scott Wilson in particular, with various other colleagues, were key in developing this. You've seen this picture before, and as Teagan mentioned, there's a voiceover possible, and it's present in English or in Pitjantjatjara, a traditional language spoken in the APY lands and a large area of South Australia and Central Australia. So here we're asking, has the person had any alcohol in the past 12 months? But a thing to note for your clinical work as well, we include a check question. If the person says, no, I haven't had any alcohol, you say, can I check in the last 12 months? What about at special times, you know, weddings or sorry business or grand finals? Did you have any grog? And it gives you the option to say, yes, I had some then. And I find clinically, very many people don't consider themselves a drinker because they don't drink regularly. They might only drink 3 or 4 times a year, but because on those occasions they drink quite heavily, they can be at risk. So it's worth that check question. What about special occasions? This is another really important one to remember is sharing of alcohol. And I've found it quite common in my clinical work, even as in a setting like Sydney, that people will report an amount of alcohol or of tobacco or of heroin or of ice. And sometimes you'll say, and was that you or was that shared? And they say, oh, that was me and my partner, or that was a group of about 6 of us. So particularly if it's a biggish quantity that's being reported, just checking, is that you or did you share it at all? What types of grog were you drinking that day? We made it very visual. In the cities, it's not so much an issue, but if you go more remotely, people may or may not describe their alcohol by the name. They might describe it by the colour of the box or the colour of the can. But for all of us, having it as visual as possible makes it a more enjoyable experience and easier to work through it. As Teagan said, there's the variety of drinking containers that are used for alcohol, and the person can say how full they were and how many of those containers they consumed alcohol out of. We've talked about the group. So we validated this in a study led by Kylie against a clinical interview, and it was found to have good comparability, good repeat test reliability. We also found when we analysed the data that if you want a really convenient, easy screening tool, you could also ask about the last 2 drinking occasions, and that gave a pretty good estimate of the usual quantity of consumption. In our sample, the amount people drank wasn't varying a lot from time to time, And if you worked out how much they consumed in the last 2 times they had anything to drink, and when were the last 4 occasions, that would give you a pretty good snapshot of their quantity and their frequency. So what did we find about patterns of drinking? And here I'm going to touch on the work of Catherine Zeng, who was in final year medicine when she did this analysis. So in that same sample that Teagan mentioned, it was a representative sample, and we used targeted stratified sampling in public spaces and in services to get appropriate mix of age and gender. And the sample that we got matched up really well against what ABS said we should have in terms of gender and age, etc. And there's Kylie towards the left, and there were a total of 9 Aboriginal research assistants and 4 other non-Indigenous research assistants. And recruitment happened at community events, it happened at services, it happened at different locations where people could gather to get a good mix, not only of age and gender, but also of socioeconomic status. So in total, 775 participants were recruited and used the app of mean age 38. And in the remote site, more than 1 in 5 spoke an Aboriginal traditional language in the home, which shows the importance of something very visual. So if we look at the breakdown of the figures, you can see that a bit more than the national figures from the meta-analysis that we looked at, but here around 77% of the sample were current drinkers. And a small number, less than 10%, were lifetime abstainers, and there were about 1 in 7 who were former drinkers. So whilst people were episodic drinkers, their median standard drinks per drinking occasion across the sample was 7.8, so just under 8 standard drinks. But they only had just over 1 drinking occasion per month. So the average amount per day was very low. The men overall were drinking more per occasion and slightly more occasions per month than the women. Nearly 75% said they'd had a dry period, a period of abstinence. And for men, this was around 60 days, and for women, a median of 90 days. So these dry periods are really significant. And interestingly, the dry periods were longer in an urban site. So it wasn't to do with remoteness and access to alcohol from ultra-remote communities. The particular remote community this survey was done in did have year-round access to alcohol. So, and the type of alcohol varied by location. In an urban location, it was wine, port and sherry, whereas in a remote location, the beer was more the thing. Those improvised containers, not your standard stemmed wine glass, were used by 40% or more of individuals. And mugs and kitchen glasses were commonly used. And of course, that's a fairly standard kitchen glass, about 250 mils. Some are bigger, but if ever one of your clients is saying they have a glass of wine or a glass of spirits, then the finger test, how tall was the glass and how full was it, is in clinical work is really useful. In the remote sites, the mouldy packs and the cans were the most common. So your standard pub glassware and the cask wine was mainly used in the urban site. As well as asking about what they drank and when they drank, James Conigrave put in a couple of questions about why people consumed alcohol. And what he found was there was an association, but if drinking met a person's basic psychological needs, they were more likely to drink more and they had more frequent symptoms of dependence. So if drinking made them feel more autonomous, more in control of things, if it made them feel more competent, if it made them feel they related to others better, they were more likely to drink a greater quantity and more often. And I think this has major ramifications on government efforts to control people's drinking. And if we look at a lot of past government efforts to try and reduce alcohol harms in Aboriginal communities, they often impose solutions. So they made people feel less in control of their own affairs. Whereas if we really want to make it easier for people to drink less, then giving them more of a sense that they can control their life and their affairs, and that they have deep satisfaction, whether that's from craft or culture or family or employment, but that finding meaning is often part of the solution. So wrapping up that section, what does this all mean? So in both Teagan's and in Catherine's studies, we saw that episodic heavy drinking with long periods of abstinence are common. So people in a clinical setting will often say, no, I don't drink, because they don't normally drink. So asking about special occasions is important. This is a challenge because many commonly used screening tools or survey tools assume regular drinking. So, for example, Audit C asks you about how often do you drink, how much do you drink, and how often do you have 6 or more drinks. And that how often do you drink doesn't cater for the fact that it's stop and start. The dependence, as Teagan said, has a similar prevalence to the general population. However, no two communities are the same, and either in prevalence or in patterns of drinking and in the context of their drinking. Understanding those local patterns of drinking through consultation, through local surveys, can help inform tailored health promotional clinical responses. So if people are mainly drinking cans of beer and you want to try and help people to understand drinking guidelines, then you might be converting it to 2 to 3 cans per occasion rather than saying no more than 4 standard drinks per occasion, if you're thinking of that NH and MRC guideline on short-term drinking risk. So, and addressing the drinking and the underlying socioeconomic risk factors and mental health risk factors should go together for the best chance of success. So that was the core on the findings. And just in the last few minutes, I thought I'd give you an overview of some of the members of the CRE. And by members, we mean the Aboriginal and Torres Strait Islander people who've been doing research with some support from the CRE, whether or not they're Sydney Uni or another uni. So some of our research is community focused. And so Benita looked at harms from alcohol in a community setting and looking at factors underlying that. Annalise Stern is just about to submit her PhD, and she's been looking at alcohol policy and to what extent Aboriginal people are given input into alcohol policy, to what extent they have a meaningful say, not just token consultation. And you've heard about Teagan's work. Then we've got some of the CRE members looking at treatment and help provided. So Christy Harrison, who's a Wiradjuri lady, was looking at how you can support Aboriginal community-controlled health services in their screening and care for alcohol. And Christy played a central role in recruiting 22 Aboriginal community-controlled health services to a cluster-controlled trial we did. And we showed we were able to support services to increase systematic screening, with a validated tool. Gemma Purcell-Coda is a Gundungurra woman, and she looked in the same study at how Aboriginal health staff provide care, how they describe using mainstream approaches and cultural approaches to provide a bicultural approach to care. And that might include things like groups taking people out to country, cultural groups, cultural enhancement, but it also could include explaining how pharmacotherapies work, but explaining it in a culturally appropriate way. So her work also highlights the importance of Aboriginal health staff in making treatment accessible and more likely to be effective among Aboriginal people. Doug James worked for many years in resi rehabs, and his PhD was on Aboriginal resi rehabs, who goes into them, the types of programs and who stays, etc., and pointing to need for more evaluation of these to better understand how they can continue to enhance the services they provide. Incidentally, other research by other people have shown that on average, Aboriginal people do better in resi rehabs that run by Aboriginal staff that are community controlled than they do in mainstream rehabs. And Liz Dale, who's a Warramai woman and is also, at last time I met her, she was a clinical psych registrar, so about to finish her clinical psych training, but also has a PhD. And she studied the cultural adaptation of mutual support groups. How should or could SMART be adapted, SMART recovery, to be better suited to Aboriginal people? And through a variety of research methods, including Delphi methods and one-on-one interviews, Liz demonstrated that there is really scope and need for cultural adaptation to make it more useful for Aboriginal people. And last set of studies, this should also say involuntary treatment. So Lynette Bullen actually works at the Involuntary Drug and Alcohol Treatment Unit at Bloomfield Hospital at Orange, and she studied what clinicians are considering when they think, will I or won't I refer an Aboriginal client? Because Lynette points out that Aboriginal clients are actually greatly under-referred to involuntary treatment, and she raises the concern that if this is a life-saving last resort measure, are we depriving Aboriginal people of that life-saving last resort measure because we're afraid of the trauma that it might inflict given the traumas they've experienced through colonisation? So that paper's been submitted for publication, and she did that as part of a Hetty study through her workplace. Shireen Hamilton's a Ngunnawal woman enrolled through Curtin Uni, and she did some amazing work on fetal alcohol spectrum disorder in youth justice settings. And she was part of a larger study, and they showed that some 90% of young people in Banksia Detention Centre in Western Australia had evidence of marked cognitive impairment or neurodevelopmental delay. And a significant chunk of those was fetal alcohol spectrum disorder, but it wasn't just FASD. But she also described the hopes and dreams of these young people with FASD and the views of their family of the strengths and the possibilities of these young people. So I can strongly recommend her work. It's uplifting despite being on such a sad topic. And Michael Doyle's a Bardi Aboriginal man who's done a lot of work on alcohol and drug treatment in prison, and his PhD was completed a few years ago. So he's an early career researcher at Sydney Uni, continuing to work in that field. And of course, we keep piling more and more people into prisons, white and black, but Aboriginal people are overrepresented in prison. And anyone who works in drug and alcohol knows that in the prison system, there's such a demand and need for treatment for alcohol and drug problems that people don't always get the treatment they need when they're inside. So Michael's looking at getting better, how we can help inform getting better treatment inside and after prison, and how we can better prevent people from going in. And finally, our wonderful support team, the wonderful Talia Reynolds, who is a Kamilaroi and Anaiwan woman, and the lovely Summer Loggins, who's a Bunjalung and Gadigal woman, and they provide research assistance, but they also get either on-the-job training or access to university courses if that's their interest. So that's the address for the website if you want to know more about the work of the CRE. But in the meantime, Teagan and I will do our best to answer any questions that may come up. And I should say that, just so you can make really curly questions for Teagan, Teagan has lived and worked both in an urban and a remote setting. So she comes with that great dual perspective. Thank you.
Thank you very much, Kate and Teagan, for all of those insights. We have some questions coming in, but if I can jump in first, I think the insight there that the dependence tends to be reasonably on par with other communities is fascinating, but perhaps there is more episodic heavy drinking in Indigenous communities. How do we, what are the best ways to kind of, is there any sense of how then we can then address treatment of that and try to work with people who do have those episodic patterns of drinking? Oh, Kate, you're muted, sorry, and so's Teagan. Both of you are muted. Please, someone jump in. Don't leave me hanging.
Teagan, did you want to say something? Then I can add on.
On how to support, better support Aboriginal?
Yeah, I guess thinking about it's always treating dependence, in terms from a pharmacological and non-pharmacological point of view is something for many of the clinicians on here will be bread and butter. I guess thinking more about managing those episodic heavy drinking. What are the treatment strategies, both pharmacological and non-pharmacological, for those patients that perhaps have patterns of drinking more like that?
I think it's probably a good start is we'll find out what their drinking story is like. Like what Kate was saying, what are you drinking? How much? How often? What's linked to drinking? Like if someone might be drinking having heavy days that link to, sorry business or something. So I guess getting the story behind it, and then, everyone's different. And I guess once you get to know a person better, you see, what would help them in regards to treatment. Some people, they might, want to know strategies to say no or to drink less or benefit from, the medicines or something. So yeah, I think it's just getting to know the clients, which I also understand it's not always easy, and you have time constraints and things like that. And I don't know, Katie, if you want to add something else?
Yeah,
that's just my thoughts.
Thanks, Teagan. I think a really good point. And some people have had some pretty ghastly trauma, and I have a number of clients who have suffered from institutional abuse. And if that's driving your drinking, whether or not they're ready to do anything specific about that, just acknowledging that there's trauma there. Other people, it's a really sociable, happy thing when they drink. So understanding the context. But I think one thing I'd add is that we, in the specialist services, we tend to get a bit focused on our role, but I think there's also that role for Aboriginal community-controlled services and other primary care services, and also for community action. And all of that is sitting in our general community attitudes. You look at Australia generally, and alcohol is so embedded in our small c culture. I think, looking at every level, both at the policy, health promotion level and the early intervention level.
Thank you very much to both of you for that. We've had another question coming in, which was from Anaiwan. Given that one of the findings was that more alcohol was consumed if psychological needs are being met, which was one of the points I think made in the talk today, she was interested to know if the context of drinking is also part of the app. Is the person drinking alone or within a group setting? Annalie just says she has a hypothesis about youth using substances within a group setting to help them mitigate trauma effects, and that they get a sense of belonging within the context with the custom and rituals involved in the process. So just wondering if that is also a consideration in regards to adults and so forth as well.
Maybe I'll jump in on that one as it's more clinically oriented, but I think it's a really good point. I think in Western medicine, we get a bit hung up on the individual and we forget their context. And for all people, but even more so, I think, for Aboriginal people, who they're drinking with is really important. And with any of our clients, if their partner's drinking, trying to think about how thinking of that as a couple or as a family is important. But I also think we probably underutilise group approaches in mainstream services. I mean, of course, with COVID, everyone's underutilising group approaches by necessity. But when I've been to, these 22 Aboriginal community controlled health services, they're typically using groups, and they provide an alternative, exactly as Annalie said, some alternative socialisation, alternative connection, and enhancing that sense of meaning and satisfaction from things other than alcohol. So I think we could learn from it in mainstream.
Teagan, did you have anything you wanted to add to that, or you're happy Kate's covered it?
Yeah, covered.
Beautiful. Please keep the questions coming in. I was going to also just ask about, and look, this is probably based more on personal experience of working with Indigenous people with alcohol and substance use. Is there any, and just and this is pure hearsay, so please, that I've been told sometimes that amongst elders that sort of alcohol can be, it's almost an there can be sometimes an expectation for an Indigenous elder to drink, and that's part of the, I don't know, the group coming together. Is there truth to that? And if there is, how can we help to manage that?
I think it's very different in every community, and then who's drinking and then in what setting, and sometimes there is that expectation, like if everyone's drinking, then oh, come on, have a drink with us,
Yep.
And it's like, oh, okay, I'll have a couple with you, and they might choose that occasion to drink. So yeah, I do understand that, and it'd be like they necessarily won't drink at home by themselves or go to the pub, but if they're around with the family, then oh yeah, they might have a drink or two. And I guess maybe that comes down to that being a part of everyone, like that want to be a part of the group and not feel left out, not feel isolated, not be sitting away from everyone. Could be part of that. I don't know, but I do know, it doesn't come as a surprise, but it wouldn't happen in every community. Like I know I've got 90, she's like, oh, I'm not touching that. It's just people have the strength to be like, nah, it's not for me, not today, not for me. So
Teagan, I've heard people comment sometimes that an Aboriginal person might misuse culture and say, it's your duty. I'm your uncle, I'm your older brother. It's your duty to get me some alcohol. And I've heard people describe this as a real misuse of culture, because in real culture, you're looking after each other at a proper, deep level, ensuring the best for that person, ensuring, everyone's got food, etc. Have you seen that much in either a remote or urban setting?
I think that, like for when it comes to older people drinking, that if they ask for alcohol, it's sort of like they're the elders. So as a young person, you wouldn't say, like, tell them no. Like, you wouldn't say, oh, you've had enough, or no, I don't want to buy it for you today, because it's like out of respect, you're going to like tell them what, you're going to give that to them, because it's not, you don't want to be like, oh, I know better than you, or I know you've had too much. As a young person, that would be like very disrespectful to say that to an elder. So yeah, so if that does happen, it's just like, who am I to tell you when to stop? So if you want it, I'll get that for you. Yeah.
Yeah, thank you. No, really well described. This sense of responsibility to elders and to the people you're responsible to is very strong. Yeah.
Yeah, and that respect from, because it's their elders.
Yeah.
Yeah.
Yeah. And
No, thank
do you?
you. It's always an interesting, you know, it's always the dynamics, as you mentioned, Teagan, are always very different, you know, and I'm sure we're only scratching the surface on the number of different clinical challenges that might arise from in various scenarios and people who may have problems with alcohol or other substance use problems. So I appreciate it's not a one size fits all, and it can be hard to to make sweeping generalizations about those sorts of things. Alrighty, well look, we are a couple of minutes before 3:30, but I don't think we've got any other specific questions now. So if there aren't any other questions online, then please join with me in thanking Kate Conigrave and Teagan Weatherall for a really fantastic presentation on Indigenous, on the different patterns and so forth of Indigenous alcohol use in the communities. So thanks very much.
Thank you.
Thanks for having us.
Thanks.
See you.